lots of good minds to help us work through this today. So good afternoon. It's 12 o'clock noon. We're gathering. This is Debbie McCune-Davis, the director of the Arizona Partnership for Immunization, and we are delighted that you are with us today. Our numbers are a little different than our traditional community and provider awareness meetings that take place on this date. And our current count is somewhere in the range of 150. So you're going to see us try to move through this agenda pretty quickly and make sure that everybody who's with us today has input. So 2 requests. One is to chat into the chat box that you are here. We do not have time to do introductions, but we do want you to know who's with us today. So chat in your name and your organization. That's really important for us to know who's in the conversation today and to allow us to follow up with you to make sure that when we get to our action items, you're all involved. So Rebecca, let's go ahead and take a look at those slides. As you'll see that we've had really good response to this call to action. And that's the range of organizations that are with us today and the numbers to reflect their participation, which thank you all. This is marvelous. And so I think we will do our best to come up with some plans to get all of you on the front lines. And these are the roles of the folks who are with us today, everything from vaccinating patients to managing clinics to helping with education and policy. So it's a wonderful group. And next slide. And then the question, are you worried that COVID-19 will impact vaccine visits? And you can see the overwhelming responses from those who responded when they registered is yes. And what may impact those visits the most? And again, fear on the part of patients in this unusual environment that we're in, but also there are other issues that could become challenges as we move forward. Next slide. And then our numbers. We had done a little bit of work last year looking at what the impact of flu and pneumonia were on hospitalizations and on costs. And you can see those numbers gathered from the ADHS website. And then the costs implicated, the 3-year estimated costs, and then the reported COVID hospitalization cases from February through August 7th at 19,000. So you can see that this season, this flu season, isn't going to be like the ones that preceded us. So that leads me to the introduction to Dr. Bob England, who has served in numerous capacities in Arizona, both at the state and multiple county levels, and in partnership with counties in planning flu seasons before. So Dr. Bob, I'm going to turn it over to you, and you're going to give us a realistic perspective on not only is the flu season never a good flu season, but what have we got to look forward to this year? So here's to you.
Yeah, I've got the easy part because I don't have to know the specifics. I sort of get to say we don't know exactly what's gonna happen. So, but this flu season, this flu vaccination season may be the most important one that any of us have ever lived through, because the worst possible thing that could happen is a robust actual flu season because of decreased uptake of immunizations, combined with a surge of COVID in the fall and through the winter, so that the healthcare system not only has to deal with the combined load of that, but just as worrisome, has to deal with trying to differentiate the two in so many people as they present for healthcare or not present for healthcare. You know, what are we going to tell people if we have lots of flu and lots of COVID occurring simultaneously? So Um, what might happen? Well, you know, if we hit the beginning of the flu vaccination timeline in earnest, and we're still at some relatively significant plateau of COVID cases, I think everybody's foreseeing, and you all are, it showed in that poll that you answered, everyone is worried that those, especially folks who are at higher risk, who may usually get their flu shot, are going to be afraid to go into locations where they usually get their flu vaccine. And therefore, we've got to think really broadly about how we're going to deliver it to people in a way that both feels, both is safer and feels safe enough to people that they come out and actually get their vaccine. Then what's going to happen when we hit the flu season itself? Actually, it was Jennifer who pointed out the data to me that what you're seeing in the Southern Hemisphere is really interesting, because obviously if COVID surges first, and you can see it right there on that graph. Sorry, I stole your thunder there. I know you guys were going to do that slide later. But the point being that the same severe mitigation measures that protect against COVID obviously will disrupt the spread of flu and other upper respiratory viruses as well. So the point being that if COVID is surging again in the winter before the flu season is off and running in earnest, then we might, in reinstituting mitigation measures to try and slow down COVID again, we might take much of the flu season away, even if we don't vaccinate folks as well as we want to. But, and it's a huge but, if the flu season gets rolling first and there's a significant amount of flu spreading before we do any measure like that, then it could be the other way around, and we could see it may be too late, in other words, for those other mitigation measures to have as much of an effect as we wish they would. So I'm just saying, I'm really grateful for the interest in flu vaccine this season. I am really grateful for all the players who are jumping into it that may not usually do so, and those who are willing to think about alternative models so that they can, so that we can all not miss any freaking vaccine opportunities and get as many people vaccinated as possible. You know, it is possible to hit herd immunity against the flu. We just never do it. And this is going to be the year in which we need to try our hardest to pull it off. Anything else you guys want me to touch on, or does that tee it up well enough?
Is this year we try to vaccinate 80% of the school kids?
Yeah.
You know, your big dream.
Yeah. Well, you know, when I say it's possible to hit herd immunity, it's possible to hit targeted herd immunity without even touching most of the population. You just vaccinate school kids. Now, if COVID has the schools closed, then it would be easier to hit that herd immunity target because you're going to have less transmission going on between kids than usual. But this is the year to do it if we can possibly do it. If we, just in a regular flu season, we know the data is clear. If you hit 80% or more immunization rate, flu vaccine rate in school-aged kids alone, you will take more than 90% of the flu season away from all of us. And it is a freaking tragedy that we never do it. The other thing for people to keep in mind this year is how are we going to dovetail COVID vaccine with this if we're incredibly lucky and sometime early in the new year we've got COVID vaccine available to some extent. And I'm shutting up now.
All right. Well, we hope you stay on. And
yeah, I am.
So my name's Rebecca Nevedale. I'm going to be the timekeeper today. And I like that, Dr. Bob, you mentioned that this really is a bit of a trial run for the COVID-19 vaccine for when it comes, right? Because for the first time, a lot of our healthcare agencies and partners are immunizing people outside their patient panels and outside their traditional population. So FQHCs, some private offices and hospitals, they're hosting community-based clinics for the first time. And our pharmacies and the counties have all had a lot of experience and have expertise in doing those kinds of mass immunization clinics already. So I think that's why we thought this meeting would be our normal 30, maybe we'd get 50 people, but we have almost 150 people already logged on today. And I think that's what people are wanting to hear about from each other is how do you immunize outside your traditional populations? So we don't have a ton of time to dig into the weeds today, but if this is valuable to come together, or it would be valuable to come together in smaller groups and focus on smaller topics, you can always let TAPI know and they can make sure to provide those spaces for you. So I think we're all Zoom professionals now. So remember, we do have an aggressive agenda today, but we do also hope that people can talk verbally and ask questions in addition to that chat box. So if you are speaking, hover on your Zoom screen, bottom left is where you mute or unmute. If you are just calling in, you're gonna do *6. And if Dr. Bob can figure it out, you can figure it out. So it's not that hard. And if you're speaking, we hope that you turn on your video because it's so much more fun when we get to see your faces. And as we're starting to bring together partners who haven't worked together, it's important that they see your face too. So same kind of area of the screen next to the mute is where you start your video. And on the bottom right of your Zoom screen is where you're gonna find your chat box. Because we have so many people, we fully expect there's gonna be robust conversation in that chat box. So use it. The real intention of this meeting today is to just get on the same page of who's immunizing who, where are they doing it, start learning where are those gaps. So this agenda was really designed to share information and for you to be able to ask clarifying questions and give ideas. But we know that with over 100 people, we can't all speak every time we want to, so please use that chat box too. Also, we are recording today's meeting, but it's just for our notes, so feel free to speak as openly as you feel like you should. So we're gonna start today with a policy and environmental update. We're gonna hear from ADHS. We are gonna hear from our manufacturers about privately stocked vaccine or vaccine for privately insured patients. And then we've asked representatives from a bunch of different immunizing groups to share a really brief update and have tried to craft as much time as possible for Q&A in for you, either through the chat or verbally. And because we really want to figure out how can we help each other. There are plenty of people that need flu shots. This year, there are plenty of doses to go around, and we really want to make sure that people are working collaboratively, and that's TAPI's job, is to help you do that. So we do want to make sure that you learn who's doing what, and that as public health, if we're all public health, we know where the gaps are. And we thought the best way to do this with this many people is to have you spend just 5 minutes of this meeting filling out a really brief survey. So if you go to the chat box, so hover on your Zoom screen, go to the bottom right and click on that link. And we're gonna spend 5 minutes for you to take that survey really quickly. And we're gonna show you the data from this survey in the meeting today. So go on that, in your chat box, click on the link. And we're going to take 5 minutes to do that survey.
Rebecca, you think it's a good idea if I email those participants that are just on the phone? I'd have to email it to everybody if you guys didn't mind a second copy.
Yeah, I think that should work. People are good. Yeah, that'd be great. So I see some of you are unable to fill out Google Docs. For security reasons, your organization doesn't allow you to do that. We will circle back with you if that's okay and recreate that link or the questions that folks are answering, just so we can get the information. We want to keep populating this over time so that we can help connect you guys. But thanks for letting us know that. And for those who are logging in, if you can go to your chat box and click on that link, we're asking everybody to spend just about 2 more minutes completing a survey, a brief survey for us. It looks like responses are still coming in, so we're going to give you 1 more minute. Okay, we've hit over half of our folks. So you can go, if you're still finishing the survey, go ahead and finish it. Continue finishing it. But since we've hit over half of our folks, I think we're safe to go on with our agenda. So I want to first welcome Dana Goodlow from ADHS. Dana,
Hello.
hi, you can tell me next slide. We think it'll help.
All righty. Hi, everybody. Glad to see that there's so much participation in this call today. I have my slides in front of me as well, so if you are actually seeing me, I'm going to be looking over here. But I just wanted to also let you know, I am the office chief for the Immunization Program Office with the Department of Health Services, and the things that I'm going to share with you today are from the public doses perspective. So what happens with your private doses will be different, but this is some of the information that we know at this particular time for the public doses that will be coming into Arizona. Next slide, please. Can I make my own go? There I can. Okay, so everybody wants to know, when are the doses coming? And the good news is, I think they've started. We have a little bit, very, very little bit, like 100 doses in the CDC warehouse, but the news is that they are going to be coming. So my best advice to you for knowing when there are vaccines available is to check ACEs frequently, because that's where we're going to let you know. That's where the order set will be opened up, and the presentations that we have available to you will be in your order set. So check ACEs frequently. We have 320,000 VFC doses that we order annually that we are expecting to be delivered, and the CDC has found us an additional 40,000 doses for VFC children. We have about 20,000 doses for CHIP children, and normally with our Vaccines for Adult program, we have just under 9,000 doses. But this year, there will be some supplemental flu doses that are going to be available for adults. And those are only going to be available to the county health departments and the FQHCs. And that's because it is really so limited. And those doses will be coming later in the season. They are anticipated to begin arriving in the warehouse in October and throughout January. One of the things Jennifer had asked me to do was to share our presentations of the different flu presentations that are available and the dosage and those kinds of things. We are in the final stages of getting that ready to pull together, so we'll be able to share that through TAPI in the immediate future. And the biggest takeaway for me for you all is, please don't wait on presentation choice. We really, especially with the vaccines for adults, we just really are not going to have the luxury of choices so much this year. When we did the pre-book for the additional VFA doses, we literally, this is how many doses we want. We did not get to say what type of vaccine, whether it's a syringe or a multi-dose vial. We didn't get to pick any of that. We just said we want more vaccines. So just be aware that you not get your preferred presentation this year. That can't matter. We just have to vaccinate. Next slide, please. So the eligibility of doses this year has changed just a little bit. The VFC doses are still just for VFC children only. So can't use them for anybody else. VFA doses, vaccines for adults, and the supplemental adult doses that will be coming, again, for the county health departments and the FQHCs, can be used for any adult. And this is a change. Normally, we would want uninsured adults only, but this year we've gotten special permission from the CDC that our VFA and supplemental flu doses can be used for any adult. Yet again, we want you to be looking at the insurance status of the folks that you're vaccinating. If you have the opportunity to use your private and to bill their insurance, we would encourage you to do that so that we get more vaccination across the state for our adults. And again, focus really here is on the risk adults in Arizona. So as much as is possible, that's where we want to target these doses. Next slide, thank you. And so where do we talk about it? Where do we report it? As is always the case, ACES is the place for all of it. You're going to order it there. You're going to receive your orders in ACES. You're going to include the administrations that you've done in ACES. You'll do inventory reconciliation. And of course, timely reporting is always, 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 always important when you're in ACES. And what we're thinking is that this is a really neat opportunity to practice for COVID vaccine, which we think will be coming maybe this fall. We're hopeful. Next slide. So things to think about, things to share. The Department of Health Services is actually working on creating a flu campaign. I think I've talked about this in some of our other meetings. It is intended to be extensive from children through seniors, everybody high risk, low risk, everybody. If you live in Arizona, you're going to be included in the flu campaign. There was a small work group that was looking at concepts. That kind of got sidetracked a little bit with leadership at our agency and work with the governor's office. My understanding is that all of that was under review this past Friday. So hopefully sometime this week, we will see what that flu campaign actually looks like, and we'll be able to start sharing some things out with our partners. Non-traditional vaccination activities, we shot an email out end of June about thinking about non-traditional vaccination sites. Maybe you want to do a drive-up clinic. Maybe you have other brilliant ideas or want to work with other folks. Our guidance is super high level intentionally. We want to just give you some things to think about in the setup, the execution, the reporting, and of course, keeping the vaccine safe. So watch for that email. I think Tappy sent that out, but we can certainly send it again. And again, the intention was ACES is the place with the helpful vaccine folks. Thank you, Jim. So we want to be sure that you have access to that super high level document. Also this year, and you'll see it's starred and limited, says borrowing of VFC, and it should also be VFA if need be, flu vaccines is allowed. Traditionally, the CDC does not want us to be using VFC or VFA vaccines for anybody other than VFC or VFA eligible people. This year, they are allowing us to do just that. So we also sent out an email a week ago, 2 weeks ago now, that talks about that. And there's just a couple of things to be aware of if you're going to be doing that borrowing, because as you heard, I've got X number of vaccines that are coming and I don't have presentation choice. So if you use your private vaccine and I don't have that same presentation, I can't replace it with the same presentation. You're going to get something else. So just be aware of that. And sometimes I think we struggle a little bit with lot numbers. And the thing I need you all to really, really, really keep in mind is you have to submit the borrowing reports so that your inventory and everything in ACES looks appropriate. But again, as I said, there's a flyer out there now that talks about how this is allowable for this flu season. It will end June 30th of 2021. And then we'll be back into our traditional rules of not borrowing vaccine unless it's a really critical need. And so then how does all of this align with our COVID presentations? Kind of goes to the next slide. And really that, there it goes, is to be thinking about a whole lot of things. Your cold storage capacity would be one of them. Do you have room to store flu vaccines, COVID vaccines, routine vaccines? How are you going to ensure that you're vaccinating for the regular series during this challenging time? Are you familiar with reminder recall? Are you using reminder recall? What are you going to do if you have people that don't show up? For COVID vaccine, you need to be thinking about more than one dose. The 4 that I think we know of that are most likely to come first are all very different, and they are not interchangeable. So making sure that your staff is trained is going to be critical. Making sure that these vaccinations are entered into ACES is really important, especially when folks are coming back for a second dose. You want to be sure that they're getting the same kind of presentation. If they're not, then they're not going to be as protected. And then how do you prevent COVID spread while you are all together doing regular vaccine, kid vaccines, adult vaccines, flu vaccines, COVID vaccines? There's going to be a whole lot of logistics. So we really are encouraging folks to start thinking about those kinds of things right now. So I think that's all I have. Miss Rebecca, I don't know, questions later?
Oh, no, we'd love, if people want to ask questions now, we have almost 10 minutes, about 10 minutes to ask.
I talk fast.
There you go. We wanted you to say, oh, the COVID vaccine, it's coming tomorrow. So, but I guess we're not making.
COVID vaccine might be coming in October, but again, that's going to be really limited. And, you know, tier 1 is probably going to be our highest risk folks that will be vaccinated. But the CDC is saying that they expect a pretty good amount of vaccine between January and June of next year. And that they have secured 660 million COVID doses. So that's enough to vaccinate everybody in this country with 2 vaccines. And interesting little piece that we've heard, not sure how this is going to translate, but so far they're not testing the COVID vaccines on children or pregnant women. So neither of those would be eligible for vaccination initially until they can do some more testing around those age groups.
Yeah, I think we'll continue getting information out, Tappywell, about the COVID vaccine as it comes available. We are going to hear from manufacturers about vaccines for privately insured kids, but if you have questions about anything that Dana talked about or those federal policies, go ahead and unmute yourself to speak up or chat them in and we can read them for you. Will the mass immunizers and FQHCs have to report adult flu to ACES?
Yes.
Yes.
You get the vaccine from this, the expectation is that you're reporting in ACES.
Okay.
Are all of the FQHCs, the adult programs, signed up with ACES, or is it just one sign up with ACES for all of the departments in the FQHCs?
Say that again. I think you're tripping me here.
Yeah, that was a convoluted backwards way. I know that all of the FQHCs are signed up for ACES for childhood, but do they have to have a separate login for all of their adult clinics as well, or is it just one?
Right, that's a really good question. The way that the adult piece works with some of the FQHCs, because the adult program really is primarily for the county health departments because it is so small, only the county health departments actually have FQHCs as partners for the adult. So the majority of the FQHCs in the state have just a VFC account. And so what we are working towards right now is setting up their VFC account with this order set to be able to order adult vaccines. So I think the short answer is no, you shouldn't have to have a separate login. You will have a separate order when to order the vaccine. Additionally, the few FQHCs that partner with the county have to go through a local approver process. So that county has to say, yes, it's okay if we send the vaccines to them. We're taking that away for these supplemental flu. So for the FQHCs, we'll be able to order the flu for adults directly in ACES.
And we're getting a question about data entry in ACES for adults. Will it need to be entered the typical way, or can they just do names and date of birth?
No, we need all of it.
Need all the information, okay.
Yeah, typical way.
Another question of, will you be providing training for ACES for the new adult providers or for when it gets to COVID?
We have a ton of training available right now. Our learning management system is stood up, and so that is always an option. You can log into ACES and click on the link to go into the IPO train, and there's all kinds of pieces in there. So that's going to show you reporting in ACES. It's going to show you cold storage, how to order. All of those things are already in there. Additionally, we are planning to do some of our keeping on tracks trainings that we've done a year and a half now. Hopefully we've been doing them. Kind of got sidetracked with COVID. Those will be making a comeback, and hopefully the first one of them will be September or October. Do you have a plan for supply chain shortages that may occur even if there's enough vaccine? I do not have a plan. I don't know if anybody else does. I'll say that with the COVID vaccine, COVID ancillary supplies coming together, and the CDC has been working on a contract to be sure that there is enough of all of those things. So that may be a piece, and certain emergency operations center has to jump in and hit the strategic national stockpile. So we can do. Than that, I have a definitive plan.
Hi, Dana. It's Dr. Copeland. Can I ask you a question?
Yeah.
Hi. If people want to do mass immunization clinics, even if it's for kind of their own population, but they want to do them as a drive-by clinic in order to be kind of safer, more socially distanced, not having people coming in, how do they keep that vaccine safe? What's the storage for that, you know, since it's temperature sensitive and they may be operating outside?
So that's really incumbent on the provider. That is one of the pieces, obviously, that we want to be sure that the vaccine is maintained at the proper temperature. So if you have appropriate coolers, those kinds of things, data loggers should absolutely be included in whatever unit you're using to keep the vaccine cool. Checking temperatures hourly to be sure that the vaccine is, if something is going wrong, you still would have time to move that vaccine back into the building and back to its normal cold storage unit to protect it and keep it safe. But the onus on that is the provider's offices.
Yes, and I think I asked the question just because I think people are hesitant to do it, but it may be a very good opportunity. And there are coolers that are sold specifically for that. And like you said, there are, you know, thermometers and things that are made to do that. And so people, if they're thinking about it, might want to, again, start to investigate that now, because, you know, the season is coming, and like you said, vaccine will be available.
Right.
And so hopefully, again.
Well, and I do have a bit of a supply of the digital data loggers. So if you're a VFC or a VFA enrollee, shoot an email to me and we can send some data loggers out to you. But yeah, it's one of those things. Like I said before, we purposely left this really high level because everybody's going to have a slightly different idea of what's going to work best for them. Some folks don't really have a parking lot to be able to go and set up in. So really our takeaway is we really just want you to do your very best to keeping this vaccine temperature maintained. And the way that you know that you're doing that is with the digital data logger and hourly checks. I'm trying to
and
go
Dana,
back.
I just sent that to everybody so you all have the document she's talking about and the slides.
All right,
So,
I'm scrolling backwards on questions. Data entry, okay.
Well, we don't, I wonder, does somebody have another question that they wanted to ask out loud? Because I think we can continue, we can answer the chat ones as we go on too. Anyone else have another question?
So Rebecca, this is Debbie McCune-Davis, and I have a question. We have some partners that want to do community-based flu clinics, maybe at a church, and there may be some ancillary costs related to that, one of which sadly might be security. Are there funds? I know we're talking a lot about vaccines and traditional delivery systems, but if we step outside that traditional system, are there any resources to support those kinds of activities?
Not from my side of the shop, no.
What about on the campaign side?
The flu campaign, the media campaign?
Mm-hmm.
No, there's no funding for that available.
Okay. Okay. So in other words, when we recruit partners, they need to be prepared to bring some resources to the table.
Yeah.
Okay.
I can
Important to
get
know.
that.
Well, so we've heard a little bit about what presentation, well, we're going to hear about what presentations soon. You'll be emailed that later, but doses and when they're coming, everyone's going to need to make sure that the folks who are organizing your flu clinics, whether they're mass community-based clinics or inside your office like every other year, know what to do with ACEs and how to get those doses accounted for. You're going to need to look at policies in the event that you are swapping, because there's limited use for swapping. If you have other questions about federal policies that you need answered, chat them in. Dana, you kind of look at that chat and try and answer them now, or we can circle back with everybody afterwards. And if you have, there's a lot of questions about what's the email for where can I get data loggers? Do I have, make sure, put all your questions in. We'll try to get all those resources to you. But I want to go back to Dr. Copeland now. And can you tell us about Access as the health plan task force?
Sure. Thank you very much, Rebecca. So as the Access medical directors, or each of the health plans as well as the Access itself, we are all very concerned about flu vaccine. And so after we had this topic come up multiple times on our medical directors meeting, Dr. Sarma and Dr. Salick and Dr. Ta basically asked several of us to form a task force to kind of figure out how we can, again, promote flu vaccination amongst our members, but also support the campaigns of everybody else rather than kind of reinventing the wheel. What can we do to provide kind of a consistent message? And so the 7 health plans for the Medicaid access have gotten together, and we're really just, again, looking at different things. And that's why this flu summit was so timely for us, because we really wanted to hear what everybody else was thinking. We knew ADHS was going to be having their campaign. And so our focus is kind of how can we support that? How can we help get that message out? How can we, again, come across very, very consistently? Because we know that already we are seeing lower immunization rates amongst all of our children. And so we're concerned about the low immunization rates in general, and we want to promote that. But then, kind of echoing what everybody else has already said, we're concerned about the impact of flu being superimposed on COVID, or vice versa. If one goes down and the other goes up, then that's also going to be a significant concern. We have very regular talks about the strain on the healthcare system as it is, right? We know that hospitalization is up, the use of the ICU is up, and again, hopefully we're seeing that trending downward. We're seeing at least some plateau right now, but we know that the healthcare system is strained. Somebody made a comment about the use of PPE for immunization clinics, and we know that PPE is not in great supply. And so putting all of these things together, we are very concerned, and we really, again, want to be sure that the flu vaccine is widely available. But then also there's concern, again, there's a lot of disinformation about vaccinations in general. And then especially with COVID-19 getting a lot of publicity regarding vaccines, then there's also a lot of myths being circulated and some valid concerns, again, about testing and the rapidity of it getting to the market. And so we need to be able to reassure our community that the flu vaccine is safe and should be given and is a great strategy in order to prevent further illness. And again, that kind of superimposed on COVID as well as other things, pneumonia and just all the other things that circulate in our community. And so our biggest thing is how can we help promote the message? How can we have a consistent message about immunization? How can we get the message out to our communities about the providers who are offering flu shots, who are doing mass immunization clinics, about, if kids aren't in school, there's a concern, again, that maybe people will see it as less important because the kids have less risk of exposure. And so then maybe it will not be as high. And then we're hoping, again, to build upon all the things we learned from this in order to, again, increase immunizations across the board. Again, since we know that those well visit numbers are significantly decreased and therefore immunizations are decreased, how can we, again, use what we learned through the flu vaccine season to increase those? And so really, my job here today is to listen. And I saw that Dr. Sarma was on, Dr. Tax on, Dr. DeBry is on. So several of us are here to learn everything we can from what's already being done, and then kind of coalesce around that message and broaden it and broadcast it in whatever ways we can as health plans to just support all of Arizona, like you said, in getting flu vaccine.
Thanks. Yeah, when you all registered, you were asked what kind of resources do you need from TAPI or from other partners, and quite a few health plans responded and are on here, and that's exactly what they said that they needed was, we need to know where you're doing clinics so we can tell our members. We need to be able to say the same thing. So does anyone have any other questions for about access, or you can go ahead and chat those in if you'd like, or unmute yourselves and ask.
Right, so this is Dr. Art Mullen. I have a question.
Go ahead, Dr. Mullen, yeah.
How are you today? So basically, first off, again, we do want to get as many immunizations out as, because in order to preserve the capacity and function of our healthcare system, because if we don't immunize from influenza, then people are not going to know whether or not they have the flu or they have COVID, and they're going to be running to the emergency rooms and urgent care and everything else. So I think it is critically important what all of you are doing. We are partnering with Maricopa County as well as Pima County health departments to do this and implement a program for this year. So some of the questions I have, and pertain to actually the specific clinics. Are we requiring, again, we talk about the PPE. Historically, nurses would have gloves on at the clinics, and sometimes, and they would change them periodically, but they weren't required to change them for every individual that they immunized. What is the posture from your perspective as far as that's concerned? That's the first thing.
Well, for access, I know CDC, Jennifer, CDC is saying that if you choose to use gloves, because they're not recommending that you use gloves for every patient yet, but if you choose to use gloves, you should change them between patients, right, Jen? Didn't we just look that up?
Yeah, and I believe that's what it said. It's still optional. It's PPE. It's using gloves because of PPE to protect the healthcare provider, not because it's typically used for immunizations, but change them between each one, just like you would if you were seeing a sick patient.
Right.
So, there's no definitive, decision on that. Because I've researched the literature also, and tried to reach out to the CDC, and not really had much of a respond.
I know that we will, after this, CDC does have a guide for mass clinics in COVID that they just published. So we'll make sure that we send that out as well. And then as those questions about kind of the nitty gritty details of how are we going to do this in non-traditional settings and with people who aren't our patients, part of our patient panels. I think that we do need, you probably all need to dig into those weeds. Keep chatting and asking, like Dr. Mullen just did, those questions. I don't know if we'll be able to get all of them answered today, but we can certainly bring folks together again to do that. And for specific to access, just know Dr. Tack just chatted in that Access is looking to change the AM/PM to include pharmacists, and we are going to hear from the Pharmacy Association later today. So hopefully, Kelly, that's a heads up to you to give a little update about that if you weren't planning to already.
The other thing is because so many people at this point have lost their jobs and do not have health insurance, one of the markets that we are particularly trying to target are the underinsured or the uninsured. So those are two particular markets which I think will help to immunize many more people than historically when we have done this. I kind of got into this with conversations with Dr. England about 4 or 5 months ago when I was concerned that the flu, epidemic could wind up occurring simply because of the COVID epidemic. So the health insurance, I think, is going to be a major issue. And so we have to really try to focus on those folks that really don't have any insurance. The other thing is, I'm happy to help in any way in promoting influenza immunizations. I'm medical correspondent for the Good Morning Arizona show. So I'm on every week, generally talking about COVID. Actually, this Sunday I was talking about the importance of getting influenza immunizations as well. But I'm happy to, be a source for promoting, the immunizations as much as possible. So
good. Thank you.
You're welcome.
All right. Well, let's hear a little bit about, and keep all that discussion going on in the chat box. Let's hear from our manufacturers about our privately insured folks. And we have a lot more speakers left. So you each have just a few minutes, and I apologize in advance if I have to cut you off. So, but AstraZeneca, is somebody on the line? Do you want to talk a little bit about what you all are planning for the year and how you're seeing this looks for our privately?
Yes, hi, this is Whitney Meadows. I'm the vaccine business manager for AstraZeneca and for FluMist. And just to give you all an update, we plan on CBER releasing our first lots this week. And obviously there will be a lot of prioritized doses heading to the CDC first thing. And then we fully anticipate to have 70% of all of our doses shipped out by the end of September. And just a reminder, if you have providers that are still wanting to bulk up on their doses that they're going to have available, we still do have a couple of million of doses of FluMist available for their patients ages 2 to 49.
Thank you.
Is there anything I'm missing that you think I should hit on? I'm going first.
When can they expect their
private doses to be in the offices? So when we release those doses this week, it'll take 2 or 3 days for those to get sent out to McKesson and FFF, which are our distributors, and then it typically takes another 2 or 3 days. So as soon as those lots are released, like I said, we anticipate it to be either this Tuesday or Thursday. It should be roughly a week before they should see those hitting their physical locations.
And do you have resources? We had gotten a question emailed to us ahead of time about oh, that was a VFC. Maybe Dana, you can weigh in. I don't know who weighs in on this question, but the supplemental doses include FluMist for 2 to 49. Should counties and FQHCs start to plan where to distribute those?
So I've got some other states that are definitely utilizing, because we were able to produce more FluMist this year than we had anticipated, and then with the supplemental funds that came in for the adult program. So what we've had some other states do is kind of shifting some of those doses around. because they'll be able to use IIV for some of that older patient population. And then they're kind of shifting flu mist into where they are able to use it for ages 2 to 49. And just a reminder, from when we ship, we've got roughly 4 months of shelf life. With us being the only live influenza vaccine, it's not going to be the same as shots. So we do try to keep in constant contact with our offices to remind them if they have any short-dated expiries coming up.
That's great. Okay, so that's a big consideration for workflows for folks too. Thank you. So let's move on to GSK. Christy, are you there?
Yes, I'm here. Can you hear me okay?
Yeah, we hear you great.
Okay, fantastic. So Christy Belk with GSK Vaccines. GSK makes both Fluarix and Fluaval. And this year, our presentation will be all pre-filled syringes. We made a decision to discontinue the multi-dose vials this year based on the fact that the majority of our customers wanted pre-filled syringes, and it allowed us to increase our manufacturing capacity. So all of our doses will be pre-filled syringe this year. GSK is planning on bringing over 50 million doses to the US this year, plus the additional doses that we'll be doing late this season, and that quantity hasn't been released, but over 50 million doses to the US. One of the things that we've been talking a lot about with providers is the flexibility of their flu doses, at least with GSK, that they can cancel or reduce reservations up to the day we say, hey, they're ready to ship to you. And also up to 30% of their total order can be refunded if the doses aren't used. And I bring that up because it was such an important part of our messaging. Our number one goal with flu during COVID is that all providers have a sufficient amount of flu, that they have the supply that they need and aren't scrambling around trying to find doses. So knowing that there's flexibility has really helped in those conversations for them to really go back and look at, okay, with COVID, with additional demand, how many doses do we need? So we feel like providers are really in a good place to have that plan and have their sort of delivery schedule set already. For Arizona specifically, GSK will be bringing in just under 500,000 doses. So you will be seeing a lot of Fluarix and Fluaval in Arizona. And the great news is that 2 weeks ago, we began our shipping and delivery. So that was across all channels. So private provider offices, hospitals, pharmacy, and the CDC. So we are continuing to ship every day, literally millions of doses every day. And our goal is to try to make sure that customers get 50% of their order by the end of August if possible. So that's a big goal, but that's what we're working towards. Providers have already communicated with us what their delivery plans are, when they'd like them. And again, we're trying to get flu in offices as early as possible, and again, as part of our COVID response to providers. One of the things that TAPI asked for were just resources that would be good for customers in flu. So GSK does have a website for healthcare professionals called gskpro.com. And gskpro.com would have all of our flu product information on it. It does have flu facts to give to patients, but also it has coding and reimbursement support if it's needed. So www.gskpro.com is a great resource to go to with any questions on your GSK flu. So I think in summary, we're in a really good place this year for 2020-2021 flu season, good for manufacturing and for delivery.
Thank you. And go ahead and chat in whatever website, and same with all the other manufacturers, other things, chat in whatever you need to get out. Okay. So let's hear, Sandy, do you want to tell us? And you can go ahead and say next slide for these.
Yeah, thank you. Yeah. Sorry, guys. I just want to, my name is Sandy Biggers, and I'm the Regional Health Public Account Manager for Seqirus Vaccines. And although many of you have probably never heard of Seqirus, we're actually one of the largest flu manufacturers in the world. I want to take, next slide, please. So I wanted to take a minute to show you our portfolio, because this year Dana was talking about the VFC program as well as the BFA program, and 2 of our vaccines will be available on both of those programs this year for pull-through. So first I'm just going to tell you, Fluad is our vaccine for 65 years and older, and that's an adjuvanted vaccine. But the 2 vaccines that are going to be available on the VFC and BFA this year are the Flucelvax, which is our cell-based vaccine currently indicated for 4 years and above, and then Afluria, which is our traditional egg-based vaccine. So this year, the good news is we have already started shipping, just like a couple of the other manufacturers. So Seqirus does a program called our distribution strategy is providing all customer with equal access. So basically what our goal is to make sure that, say, one pharmacy or Costco doesn't end up with a large amount of vaccine on hand where other manufacturers don't. So we ship across the board in allocations. So VFC as well as our private doses have already started shipping. Now just remember, so Dana doesn't cringe, is that once that we release doses, they go to, for VFC, they do go to a distribution center where the CDC allocates out by state, and then ADHS will release and let you know when there are adequate doses available from our state that you can begin ordering. Next slide. So I wanted to just share with you guys, a lot of people think, what is a cell-based vaccine? And many of you think that it's only means it's egg-free, so great for patients with egg allergies. And although that's true, the benefits to patients are far greater. When you eliminate using eggs in manufacturing, we eliminate a strain mismatch that can actually occur in the manufacturing process. Just to give you an idea, in the seasons 2008 to 2019, we had mismatched 7 out of 10 of those years. Many of us lived through those. They were not pretty years. But almost half of those that we didn't know at that time were actually caused by an egg adaptation during the manufacturing process. So that's what some of the benefits of cell-based is, that we eliminate that egg adaptation process. It may produce a truer match to the WHO selected strains, and overall vaccine effectiveness may be improved. Just so much last year, the White House actually issued an executive order with the goal of modernizing influenza vaccines and reduce the reliance on egg-based manufacturing. Next slide, please. So just want to tell you, our adjuvant vaccine, Fluad, includes adjuvant MF59. So as you guys many of you are familiar with adjuvanted vaccines, the goal of an adjuvanted vaccine is to strengthen, broaden, and lengthen, if I could talk today, the duration of the immune response, especially in our elderly patients that have a weakened immune system. Next slide, please. So to support the efforts of the CDC to get every vaccine manufactured into an arm this year, we have produced an unbranded campaign developed so that all providers can download from our website. If you'll go to the next page, it'll give you a quick preview of them. So these are all of the different resources. One's a poster. I really want to draw attention to the email populated one. It's a beautiful tool that automatically loads an email template, and you can just put in who you need it to go to, and all of the campaign has been developed based on that picture previously for you. So it's a very simple and easy to use. Gave you scripts, gave you ideas on things to use. So please look at them. They're all unbranded. I think you'll find some of them very helpful. And then I just wanted to say thanks for the opportunity. If anybody has questions or needs more understanding on cell-based or adjuvanted vaccines, please reach out.
Thank you. All
Oh,
right.
you guys, sorry, quick update on supply too. If people need additional supply in late November or early December, we believe we'll have doses available too. We've committed to the CDC to continue manufacturing as long as possible to meet demands.
Thank you. So Chad and Jen, do you want to talk about Sanofi?
Yep, I'll go ahead and get started.
Okay.
My name's Chad McCain. I'm the Key Account Manager for Arizona. I share that with Joni. She'll also speak here quickly. So an update on Sanofi vaccine. Much like many of the others, we've started shipping. It started about 2 weeks ago to all segments across the board. We will do a little over 80 million doses this year, largely about a 15% increase due to feedback and demand from customers, primarily around COVID. So we'll see a large increase this year, probably more doses than we've ever seen in the US and even more so in Arizona. So currently with the VFC side of the business, we're on track to meet all CDC contract terms for VFC. So we'll see those doses coming in according to the contract. In terms of supply, where we are right now, we manufacture 3 vaccines: high dose, which is 65 and above, which again is the only vaccine that has been licensed as superior to any quadrivalent vaccine out there. That one is actually sold out for this year at 65 plus. You can wait list for that one. Additionally, QIV, which is sold out as well. We will not be doing the 0.25 dose this year. That's been replaced with 0.5. So those of you on the VFC side, for your 6 months to 36 months who've done 0.25s in the past, you can still do the 0.25 amount from a multi-dose vial, but you can also move to 2.5. So you will not see that presentation from us this year. And then lastly, we have flu block, which is the only one that we do have left in small quantities. That's a recombinant vaccine. We have slightly less than about 1 million doses out there. So if you have any questions on that one or are looking for any of those doses, any doses at all for your 18 and above age groups, please let us know. We have that one available. In addition, I had talked to Jennifer about, we put together an adapted vaccine solutions, and I'll have you go to the next page here in just a second. And this was largely a result from our customers and their concerns about how we're going to ensure, with all the vaccine that we have in the marketplace for flu, how we're going to make sure that we actually get doses from refrigerators into people's arms. We've seen a lot of telehealth going on, et cetera. So we've worked with experts from around the country to come up with 4 different processes to make sure that it's safe, that we follow social distancing, all in an effort to make sure that with this additional doses in the marketplace, that we actually can increase immunization rates and make sure that doses go in arms. So what you will see here are 4 areas. One is a one-stop shop walkthrough. This goes piece by piece, process by process. It looks at staffing, it looks at needs, et cetera, for what the clinic will need to make sure that we pull that off safely and that we can make sure that the patients are in there getting their vaccinations. Additionally, a similar one, but for drive-through. Obviously, in Arizona this time of year, there's a lot of logistical issues. We've talked about some of them as well. With all of these, we have a planning worksheet. So we're not just throwing these at you and saying, here, go figure it out. We've actually outlined all the different steps that need to be taken place to make sure that you and your staff are comfortable, know what to do going forward. It's planned out. You have dose goals, and we can have a successful campaign this year. As we've heard from many others, we don't want to have flu on top of COVID. The hospitals, the ICUs just can't support that. And then lastly, telehealth, which I know a lot of customers are using right now. A lot of the clinics are using these, but these are some different phrases and wordology just to make sure that we focus on letting our people know and the patients know that it's safe to come in when we're going to have vaccine immunization clinics or drive-through clinics, so we can ensure that we get vaccines from refrigerators into arms. Now I'm going to turn it over to Joni to walk through the rest of this.
Thanks, Chad. So as Chad mentioned, it's the modules, so it's broken down into 4 different modules, and we really just want to share this with you at a high level, what is inclusive within this guidebook, and please feel free to reach out to us if you'd like to dig into the full document. Particularly for the walkthrough and the drive-through clinics, the guidance is broken down into 3 key platforms. As you can see here, plan, prepare, and perform. So the planning documents, they're essentially a logistical roadmap, really, just to help you get started. Have you covered every detail from making the appointment to prepping for planning the details for what's happening during the appointment, and what's the traffic flow going to look like, whether it's in a walk-through clinic or drive-through clinic. When we get to the next slide in just a moment, there's an action plan worksheet to really help you and your planning committee help to identify what that season's going to look like and what your focus may be. For the prepare documents, there's a number of outreach scripts. We've prepared messages for you for multiple channels, whether it be phone, email, text, social media. These can be utilized in both pediatric and adult settings. And you can utilize these however you need. There's scripts that you can use to reach out to your patients to let them know you have flu vaccine ready, and you're ready to get your campaign started. So for the perform section, this includes patient education, signage. All of these materials are free to download from our website. We offer an assortment of directional signage. There are posters to remind patients about social distancing, certain certainly Chad and myself are available to meet with you to dig into this in greater detail. We can help to order any of the materials in greater quantities, or if you'd like to order some of the larger patient posters. On this slide in the middle here, you can see what a little bit, and it's very small, there's an action plan worksheet. Many of our provider groups have really, really loved this particular document. It'll give you some things to focus on with your planning committee just to really help narrow down what your focus is going to be for the season. So again, these resources, they're available really just to serve as a guidance for you, as just to assist you, additional support as we head into this unique season. Use as little or as much of it as you'd like. Feel free to contact Chad or myself, and we'd be happy to sit down with you to go through it in greater detail. Thank you for the time.
Thanks. And we asked Jen Davis to talk a little bit about stability of the flu vaccine. She's also with Sanofi, but Jen, can you do that?
Yeah, it's not, it tells me only a host can share. So I will just speak from what I have over here. I don't need to necessarily share it. Basically, I was asked to kind of talk about cold chain and how to sort of maintain that cold chain. And what's really important is not only what happens in your office or in a pharmacy, for example, but also what happens when you are trying to do a clinic outside of your office. So inside the office or inside the pharmacy, it's important where in the refrigerator that vaccine is stored. So I'm pretty sure that most people that are running clinics know it's supposed to be stored in the middle. It's not in the drawer. It doesn't go in crisper drawers. It doesn't go on the very top shelf. Those places are not as stable with the temperature. They have more fluctuations, and you're more likely to have your vaccine not necessarily stay good. Every manufacturer has a line that you can call if your vaccine does happen to go out of temperature range. So I would make sure that every office and pharmacy has those numbers posted somewhere, where if your refrigerator happens to lose power and it goes above temperature, or if somehow your vaccine got stuck in the freezer instead of in the fridge, you can call and talk to someone who can pull up data and tell you exactly what you can or cannot do with that vaccine. So it's important to have that information. The other thing that I wanted to share, and I will just throw these links in the chat after I'm done speaking, but the CDC does have some guidance for planning off-site vaccine clinics. And one of the things that they link to in there is something from the izsummitpartners.org, which is a checklist for best practices doing satellite temporary or off-site clinics. And it has a whole bunch of information about temperature and how to keep it consistent. And they do talk about the temperature trackers that Dana mentioned earlier. And there's also a link on that CDC page for the guidance for offices and healthcare providers on what to do with PPE. So if you want to look at any of that, I will again throw that link in the chat for you guys when I'm done. I will also put my email address in there just in case there are any questions that anyone wants to ask offline. I'm available for that as well.
Great, thank you. So thank you all of the manufacturers, Chad, and the resources that you have, and everyone else, just if you have questions about privately insured folks and policies that are related to when you're gonna get doses or product specific things, go ahead and chat them in. Your reps are there to help you. So I want to take a minute right now. You know, one of the things we want this to be mainly about sharing information today, but we also want you to start thinking about how can I partner with others, and also what gaps can my organization help fill. So the survey that you took, we'll just kind of breeze through some of the results in here. So what counties do you plan to offer flu immunizations? I'm actually surprised to see that we have folks from every county. So that's fabulous as part of this discussion today. And it's great to see that a county wasn't forgotten. So we were interested in, you know, how many people are what is everyone's goal? Maybe someday we could even get a collective goal together that we can actually measure, right? So it looks like most of you are planning to immunize between 500 and 2,500 people. Very few are looking to immunize less than 500 people. Some of you on the call don't give immunizations or aren't sure, but and 17.5% are planning to immunize 25,000 or more. That's really cool. And if you have comments or things that jump out to you, because this is the first time that I'm looking at these things too, feel free to chat them in. So, will you have focused efforts to provide flu immunizations for any of these special populations? This is one that we are hoping you can look at and see if you need to adjust your plans or maybe offer different clinics in different communities. So it looks like a lot of folks are planning to immunize healthcare workers, which isn't surprising. Quite a few people planning to immunize long-term care staff and the residents. A lot of Native American community focus, which I know that when we logged on, we had a lot of IHS folks signing on. A lot of people looking at the homeless populations, Hispanic and Latinx, senior citizens and older adults. So here's where I guess were these this must be the other. Is that what happened, Laura? Do you want to give me like a thumbs up or something? Is this what they added in? Okay, so that's what people added in as others. So I'll sit on this for just a second and we'll be able to send you this out and populate it more, because we're going to be able to email it to other partners as they come up. But this is going to be a good one for you to look at, to just think about whether there are gaps, special populations you want to make sure you hit. Which of these statements do you agree with? Okay, so it looks like most people, or not most people, but 34.7 are only immunizing your own people, on your own property. About 30% of you are looking for partners are looking for places to go. So you have vaccine and you'd like to go to a church or a health center or somewhere to be able to administer vaccine. And only about 10% of you are looking for people to come to your to your clinic. But I'm sure that that 30% who are looking to go places want to know who the 8 of you are who are looking for people to come onto your property. So go ahead and chat that in now. And 25% of us still don't know, but that's okay. And then here's our ages. It looks like most of us, 64% are immunizing everyone. So that's great. And a lot of focus on adults, which is also fabulous. About 20-ish% of us are just focusing about kids. So we had asked open-ended questions too, and just so you know, they're texting me, the girls who were looking at this data while we were hearing from the manufacturers, that a lot of people want to help with doing messaging and aligning messaging. So that is going to be key. And a lot of questions about setting up drive-through clinic. And there's even some people who said that they have already done drive-through clinics. I'll bet you that was COVID drive-through clinics, but would be willing to share information with you about what worked and what didn't. So go ahead and chat in. If you know you're trying to do a drive-through clinic and you haven't done a COVID drive-through clinic, chat in now to find those friends who are saying, I'd love to help people with that. And there are also people who have volunteers to help you provide immunization. So if you know that you're going to need volunteers, chat that in too. And we know that already the universities have been chatting in, saying earlier today, saying that they have students that need clinical hours, and this would be a great experience for them. So we are going to continue moving on here. We asked a lot of our our traditional immunizers to just talk for like 2 minutes about what your sector's doing. So Shelley, do you want to kick us off and tell us what the FQHCs, and a lot of your folks are on today?
I know, it's so exciting that they're all on. You're going to go ahead and move the slides through, right? So of course, go ahead and go to the next slide. I need to tell you about we're the Primary Care Association in Arizona. We have been so since 1985. As the State Primary Care Association, it's our responsibility to train and provide a technical assistance to our membership in any other federally qualified health centers, rural health clinics, or tribal organizations throughout the state. Next slide. These are some of the services that were provided, and we're very well rounded through on what we provide in our health centers. Again, we have 23 federally qualified health centers in Arizona with 1 urban Indian program. All of this combined serve at about 230 locations across the state. We are down from the bottom around Ajo and Nogales, and then we go all the way up to the top with Page, Arizona. So we do cover all of Arizona. And community health centers serve the most vulnerable populations within our communities. Sometimes they're the only providers in their communities. Community health centers go out and with mobile programs to go out and treat the uninsured, the homeless, and farm workers. Next slide. Again, you can go ahead and go through this. I know we're short on time. When COVID-19, reared its ugly head, community health centers across the nation had to really move into areas that they hadn't necessarily wanted to move into before, telehealth and televisits. We were encouraged to move quickly into those programs to serve our communities, so we could at least take care of people while they were at home, while they were working, and still doing outreach with the mobile clinics and still going out through our communities and making sure that we could get patients without COVID checked out, as well as patients we suspected had COVID, get them tested. Many of the health centers were quick to roll out drive-through testing, and you can think about, maybe things that you've read on the news lately. Vital Soul, one of our community health centers, has done a lot of testing throughout Maricopa County. So, and they are doing the drive-through testing. Some of the health centers have been innovative with creating well and sick waiting rooms for their patients, so that they can continue to do well child checkups and the ongoing immunizations for the vulnerable communities that they serve. Next slide. So our role in the upcoming flu season, actually got an email today from Matt Jewett with Mountain Park Health Center saying, hey, the community health center is going to be partnering with their counties. Yes, that's one of our main objectives in 2020-21 flu season, is working with our counties. They're expecting we were actually notified by HRSA and the Bureau of Primary Health Care that they expect us to play a vital role in the upcoming flu season. We do know that doses are coming directly for FQHCs, as Dana said previously, and our health centers partner with their different county health departments to do flu clinics. This year, as was mentioned before by even Dr. Bob, we need to make sure that we minimize the community spread of flu and COVID-19. We want to make sure that we're not dealing with people that are, have both of these viruses, that we need to get ahead of it and make sure that we're immunizing our people as soon as possible. And by prioritizing that flu vaccine within the community health centers, we hope to be able to do this. And I think it also will get us geared up for providing COVID-19 vaccinations once they are available. I reached out to some of our health centers and got a couple of responses of what they're planning to do so far. Drive-through flu clinics, they're talking about that. I was interested to see what Dana was coming up with around keeping the vaccines cool. So we're going to make sure and share that information out to our community health center partners. And then getting out within their communities, doing that community outreach and making sure and getting those immunizations in the arms of everybody within their communities. Next slide, and I think that's it.
Well, thank you. And I know,
All right.
does anyone have questions for Shelley? And those of you who are calling in from FQHCs, if you want to speak up and answer, I'm sure Shelley certainly won't mind and would probably prefer it. So, but does anyone have questions for the FQHCs or for the Alliance?
Oh, it looks good, Jennifer. I mean, Rebecca.
Yeah.
Oh, and actually, it's Jennifer. I wanted to make one comment. We heard of one clinic that started doing those virtual visits and, for a well check, and then having the kids come in just for a nurse-only quick vaccine. And somebody said that their rates actually went up a little bit. They had actually a little bit better compliance with getting kids vaccinated. I thought that was awesome.
Well, I think the ability to get, it's kind of like that reminder. You're having that phone call with that parent, going through their well exam, and then having them come in, do the vital signs and the immunization. I think it kind of paves that way to be, to get that child in there to get those vaccines.
Mm-hmm. Yeah. So this.
All right, thank you.
Oh, I'm sorry. Who did I interrupt?
No, this is Shelley. I just wanted to say thank you.
Oh, thank you. And you're getting you and your clinics are getting thanks in the chat room. So thankful for community health centers. We all are. This slide here just says when people registered who worked for community health centers, what they said that they needed and what resources they really needed. So, and you'll get these slides afterwards, but we just thought it was interesting and maybe some of you can help fill some of those needs. So let's hear now from pharmacies. Kelly, fine, are you on the line?
I am. Can you hear me?
Yeah.
Perfect. So I'll give a few updates based on what I know. Some of the stuff is still in the works, so it's not definitive at this point, but I'll share as much as I know to date. So first of all, I'll just go through kind of our capacity as pharmacies. Some of you may or may not be familiar with pharmacist provided vaccination services. And so our pharmacies can be chain pharmacies or independent pharmacies, and they offer vaccination services all throughout the year, either by appointment or a lot of them do it on demand as well, especially during flu season. And that'll continue. Some of the things that I think some of the areas or the gaps maybe that pharmacies are good at filling would be patients who may not have a regular healthcare provider, haven't established a PCP, don't really have a medical home. We can service those patients. And then also with our extended hours, most pharmacies are open in the evenings and the weekends. And so we provide that convenience for those who are working and may not be able to take time off to get themselves or their families in for their vaccines. Also, pharmacies also do off-site clinics, so they'll partner with different employers, nursing homes, community centers, that sort of thing, to provide mass immunization clinics as well. So there's a number of pharmacies that coordinate those types of activities to off-site away from the pharmacy. A couple of things that have come up recently that we've been asked about. One pertains to VFC. So even though the law allows our Arizona pharmacists to vaccinate children 3 and up with the flu vaccine, we haven't been able to participate in the VFC program because there wasn't, we weren't written basically into the state plan amendment, and so it was just 18 and older. I did have a conversation earlier this morning with Access, and they, Susie Berman did communicate their desire to want to change that, but also asked about our capacity with getting pharmacies up to speed with VFC. And so prior to COVID, we had had some conversations with the Department of Health and Access talking about what this would look like. There's definitely support to do that. It kind of, I think, got on the back burner with everybody just because we've been focused on COVID-19 efforts. There very much is still an interest from the pharmacy community in being a part of that. That's been a patient population that we have to unfortunately turn away that we would like to start to be able to service. And so whatever we need to do as an association to get providers up to speed to whatever the capacity is with the health department, I'm willing to help out with that initiative. Hopefully we can get sites up as quickly as possible. But again, I think there's going to be some limitations with just scaling that with the different things that need to be done and getting the pharmacy set up, but then ordering and all of that. So I'll be following up with the appropriate people to figure out what can be done, especially maybe in areas where there might be a bigger need than others. Maybe that would be the best place to start. And then the other thing that I'll update everyone on too is, so there is an effort by our pharmacy board to allow our pharmacy technicians to help with the administration. So the pharmacist is still making all the clinical decisions, deciding what vaccines our patients receive, but the technician will be able to help with the administration. So we're hoping that this can go into effect to help with our flu and COVID vaccine efforts. The Board of Pharmacy did request rule exemption through GERC, and so that's been done. I don't know that they've received notification back if that's been approved. We anticipate that it would. Final language is supposed to be approved at the September board meeting. We're already working on a training program that we can roll out in the next few weeks for technicians, so that we can start doing that in preparation for all of this. So those are my updates. Happy to answer any questions.
Thank you. And if anybody has any questions specific to pharmacies, go ahead and chat them in, or does anyone have anything verbal that you want to, burning question you need to ask? All right, well, the other people who are really used to doing mass immunization clinics along with pharmacies are the county health departments. And we know we have quite a few counties on the line. So we hope that all of the counties will chat in what you're doing. You saw that grid that we showed of that data from the survey we took earlier. There's people here in your community who are immunizing people. So, but we wanted Maricopa County, if you could speak up and really briefly, is Macrina on?
This is Macrina.
Macrina, all right. Well, Macrina, talk fast.
Okay, here I go. I'm going to talk really fast. Okay. So our goal is to really fill the gaps. We know the pharmacies have built great relationships with their folks who come in yearly to get their flu vaccine. We know that our FQHCs do a great job with their clients and their patients and their families. We know that healthcare providers want to make sure all their folks get immunized. What we really want to do is fill the gaps. We have bought record number of flu vaccines this year. We have several partners on contract, as well as we're going to be working with our EMS, our firemen, getting those folks on some IGAs to go out in communities and provide vaccines. The good news with that is that they can also practice their plans to administer COVID vaccines. So actually work with them, providing technical assistance. And again, we just want to fill the gaps. So the thing that we can ask from all of you is, if we could have information where you're at and where you're going and where you've set up to provide vaccines, we want to go someplace else. We want to make sure that everybody in Maricopa County has the opportunity to get a flu vaccine. And if they don't want a flu vaccine, at least give us the opportunity to explain why they need a flu vaccine. How was that, Rebecca?
That was good, nice and fast.
What's you asked for?
Well, we did get a question emailed ahead about, are some counties, and I know you can only speak for Maricopa, but when you think about your colleagues in other parts of the state, are they having staffing problems because of COVID that is going to impact their flu immunizations?
So sort of keeping that in mind, what we've done is we do have several partners, either through contract or through agreement, that we're going to use to assist in immunizing. We have been providing immunizations using PPE. So far we have not had staffing issues, and we brought on some folks to help us increase our staff capacity so we can administer more vaccines. And again, we always work with our 3 universities here in Maricopa County, and they're a great resource. They're always looking for clinical experience and can go out in the community as well. So we haven't faced any of that. Okay. Not within the immunization group.
But you're not sure.
Some of the other smaller ones have. Yeah. Rebecca, we've been hearing some of the other smaller counties, you know, the immunization coordinator is the preparedness person, is the HIV person, is the community outreach person. So they wear a lot of hats. And I think that by now they've got to be tired. We're here. Let us know what we can do to help everybody.
And now they're contact tracing as well. So.
Oh yeah, just one more job.
Right. So Pima County's chatting in that they're working with Mullen, which we heard from Dr. Mullen earlier too, to increase vaccine rates in the county. They purchase an increased amount of flu vaccines for their own immunization services. So in their shot clinics that they run already, and they're working on a media campaign, so which is great. So Macrina, do you want to know where they're doing all their community clinics, right? Because you don't want to go to Christown Mall if there's a flu shot clinic at Bolero or Brazo right across the street.
Right. We don't want to, whatever all of our partners have planned, what they have scheduled to go out and provide immunizations, we don't want to go there. We want to go to where nobody else is. I mean, that really is the county health department's role, is to fill the gaps. And like I said, we've brought on a lot of partners who can help us do that. So what we really want to know is, where is everybody providing vaccines? If they have a calendar or schedule. We definitely like to work in partnership to get all the areas of Maricopa County covered.
All right.
So that's the help from us, is where are the FQHCs having programs? We know all the pharmacies. You guys are doing great advertising. I see the signs already. Come in and get your flu shot and get 10% off. That's a great motivator.
That's what
my husband.
That's what Macrina's husband does.
Yeah, he already took advantage. So yeah, just let us know where you're at so that we know where we need to go.
Okay. Anyone have questions for the county health department, for Macrina in Maricopa County, or for any of the other ones on the line? So then when we asked health departments, what do you need? They said what Macrina just said. So we want to fill in those gaps. We want you all to vaccinate. So we need as many as possible. So. And more questions about the state communications plan, which I know it's been mentioned a few times in the chat, and Dana presented about it too, but ADHS will have a flu messaging plan, and that's what we'll probably all kind of use pieces and parts of that, right, Jen? That's the plan, that we all give the same messages?
Yes.
Yeah. Okay.
So that we're all amplifying the same thing. No matter where you go, you hear from your doctor, your pharmacy, your health plan, everyone, the same consistent message.
So
can I chime in real quick?
Oh yeah.
I'm sorry. This is Dana again, and one of the things that we're working on is pulling some tools together to start onboarding folks in preparation for COVID vaccination. So our hope and our desire is that we're going to have a whole lot of names and locations of folks that are going to show interest in being COVID vaccinators. So we certainly are going to be able to share that with all of our county health departments and other partners as well. So as you're trying to identify them, we're trying to identify them, and hopefully we're going to have one cool place to catch it all.
Thanks, yeah.
Mm-hmm.
So, and Dana, this is Jennifer. Should some of the mass immunizers maybe that are working with counties, should they sign on the onboarding program, or with ACEs first now and then onboarding?
If you're vaccinating tomorrow, sign on with ACEs now. If you're getting geared up and it's going to be another week or so, give us a little bit of time and we'll go through the tool. Does that make sense?
Is that good?
Yeah,
Jen?
thank you. That clarifies.
This is Angela. It might help clarify too. Everyone that is going to be giving pandemic vaccines will eventually have to be sign up through our onboarding tool, even if they're already in ACEs.
And that's for COVID, not flu vaccines in a pandemic, COVID-19 vaccines.
Yes, thank you for clarifying. Yes, the COVID-19 pandemic vaccines. Thank you.
Yeah, I think that, you know, how things keep getting blurry between traditional flu season and COVID, and are we practicing and are we not? I mean, that's just kind of our reality right now. And using this flu immunization season as a trial run will be really important. So are there things that we all can test, especially with who we're pretty sure are going to get those first wave of vaccines, you know, your essential healthcare workers, probably your over 65 population. That's probably who is going to be bubble to the top of the list of who gets those COVID-19 vaccines first. So how is your system thinking about your efforts to immunize those populations and being able to test something about whether it's reaching them or getting them to come in or to initiate that series or whatever it is. So hospitals are immunizing outside their patient populations, and we have Donna Furlong, who's on our steering committee, but is with Banner Ambulatory Center and loves thinking about small tests of change. Me and Donna geek out about that a lot.
Me too.
Yeah. So Donna, can you tell us a little bit about how you're thinking about this, but other hospitals who are on the line, we know there's a lot of you, please chat in your plans just like we asked the counties to do.
So let me back up just a little bit. We stood up our first COVID testing center with 4 days notice. Since that time, we expanded to having 5 testing centers. And then when it got too hot because we were out in the tents, we now have moved to the fairgrounds. So the scene you see behind me is actually the Arizona State Fairgrounds. And we have done as many as 1,200 a day through this test site. So we're really excited that we were able to do this and to have this resource. And now we're looking to how do we convert that over into giving flu vaccines, and can we do it through the same type of process and do it through a drive-through process. So we're super excited to be looking at that. In fact, I have a meeting later today about how we might pull that off.
Cool. How do you know if the hospitals are providing more flu immunizations in the hospital settings?
I know that across the board, Banner has ordered more flu than we have in the past in anticipation of needing that. And our CMO has issued us a challenge to run out of flu by the end of October. Cool. So her goal is that we use up all our flu by the end of October. So Seqirus, I'll be calling you because, you know, in November, we're going to need more flu.
All right. And Jim's asking if there's corn dogs there.
There are no corn dogs, no funnel bread. I'm telling you, we just got bare bones fairgrounds out here. So
you got chips.
I know.
Fair.
Although I hear the fair is coming. They're still planning for the fair, so the end of September to the end of October. And so they told us that we could give funnel cakes with our COVID testing. So
oh, there you go. Did you tell them we'd like to give flu shots to all of them as well?
Right, absolutely. We'll line them all up.
So if there's any other hospitals on the line that want to speak up and talk about how things are going to look different in your systems, please do so. Or chat it in. Angela's saying, I love the challenge that the Better CMO gave. So I do too. We all need a goal, right? At least we need to shoot for something. We've always said we want to immunize everyone. Immunizing everyone is not a goal. We need a number, right? So saying get rid of all, at least it's something that it puts a little bit more structure around that. Paints a better picture. So when we asked hospitals what do they need, there was a lot of things that the other, about helping devise plans for drive-up clinics, member education, and a lot of tips, not just from hospitals, but from the health centers and the primary care docs too, of just how do, we're always struggling with how do we convince people to get a flu shot? How do we overcome a lot of these really pervasive myths that you hear all the time in our families and in our neighborhood groups and everything else about the flu shot. So.
Well, and I'm already starting to hear that, Rebecca, about the COVID vaccine. We're already starting to hear that it wasn't tested enough. It's too new. All the same things that we've heard about HPV and the flu shot for years.
Right.
So I think we're going to have some really strong talking points to help the strongest among us that should be advocating for this vaccine to actually feel like they can.
Right. Good point. We'll work on that too, Donna. Next project, when Donna's away from the fairgrounds. So
yeah, are we ever going to work our way out of a job yet? I know that's been Debbie's goal for a long time. It just doesn't look like it, does it?
well, if it's because there's more vaccines coming, that's not a bad thing.
No, but we got to get everybody to get them.
Yes. So we know that there's other groups too, and want to make sure that we give time for the traditional mass immunizers to share and just spend some time doing kind of a free-for-all of here's what I want these colleagues to know, or here's what I really think I need help with. Can I give a verbal ask right now? And maybe, just maybe, someone will follow up with me after this call. So there are some private practices on the line. When we asked them, they said they needed help also with drive-through clinics. I know that there were some other suggestions in the chat box about what TAPI can do to help you with that. So please, you know, continue chatting those suggestions, where our ears are open for you. Lots of discussion about PPE. Quite a few practices talked about that, as did the FQHCs. The universities need to put their nursing students at at your site, and you know, this is really critical for nursing students, for, you know, everyone needs, you know, students of lots of different professions are really having a hard time getting their contact hours.
If I could chime in, can you hear me? This
oh
is
yes,
Jill.
please.
Yeah, I teach nursing at ASU, and when I lived in Arkansas for 21 years, our students used to help give 250,000 flu shots every fall for our bioterrorism practicing, you know, the drills for our state practice. And it was a wonderful experience, and we're trying to help do that here. But if anyone wants our help, we have to have a contract with your agency. The ASU requires it, so we have to start planning ahead. We're trying to work with Maricopa County Health Department to try to do a drive-through flu vaccine clinic, maybe with the fire department, but we need to get a contract with that agents, with the fire department. So be aware of that. You can't just say, hey, can you come tomorrow and do this? So it's an academic issue. So just be aware, if you want our help, we'd love to help. And also we have certain days when the students are in class, so it's not as wide open as you would think, but we love helping with flu vaccines and COVID. Thanks.
So are nursing students allowed to perform COVID testing?
Oh, they actually are not. I've been doing COVID testing for quite a while now. I helped in April with the nasal, but now we're doing the ASU saliva testing. Anybody who helps with the ASU has to be trained, and they have to take all these environmental health service classes and waste management and HIPAA and all of that. So a lot of them have not taken that training, but they can give flu shots with faculty supervision or RN supervision. So if we have RNs in the health department that want to have a student with them, they can give shots under their supervision.
Thank you. Any of the other universities want to chime in, or? I'd imagine that contract is going to be relevant for all of the universities.
It doesn't take long. You just have to get the form filled out and then get it through our system and their system. And we can do it within a couple of days. We just need some notice.
Okay.
And this is Jennifer. Quite a few of the universities have expressed the same thing with having nursing students available. I know some of you need some staffing help as well. But there was a bunch of headlines this weekend about universities requiring flu shots for students. Some I saw had a deadline of November 1st. That's probably a little early, considering, you know, a lot of our doses are going to come November, December. Have any of the universities looked at something like that?
All of our hospitals require September 20th to get their flu shot. That's always way too early, but that's been an annual issue. Not November 1st. For the nursing students, I don't know about others, but to go into a hospital clinical, if we can get in there, they have to have their flu shot by the 20th of September.
So some of the new universities are starting to say all students. It's a requirement to be on campus, which I thought was pretty bold. And there were, I think, 2 or 3 that were in the news this weekend.
Big schools, University of California, I think, right? Or, you know, a big.
It's a good idea. That's often, we have anti-vaxxers out there in campus.
Yeah.
Yeah.
So there are also, just to bring your attention, Doc, there's some talk about reimbursements for those of you in the private practices. Dr. Tax clarifying a few things in the chat log right now. Donna wants them to require more than just flu while we're at it. Well, we all want HPV and you know, everything, but today we're just solving one disease, Donna. Okay. So does anyone else have other thoughts or things that you feel like you really need to share, you wish was talked about, especially the mass immunizers who aren't pharmacies or counties, are kind of traditional, like Dr. Mullen does, or anyone else that didn't get, your sector wasn't represented?
Hi, this is Shanika with Banner Health. I had a question which is too convoluted to type in. As we advocate for the flu vaccine and when we get a COVID vaccine, some of the things that we're hearing about antibodies and, you know, some people not retaining a good level of antibodies, how would we advocate for the COVID vaccine if they're saying, you know, you can get COVID and still not have immunity? How do we advocate for giving the COVID vaccine and possibly still not acquiring immunity?
Yeah, that's a great question. What are people's thoughts on that? How will you do that? Dr. Bob, what do you think?
Getting myself off mute here. I think you tell them what we know. There are going to be trials before it's licensed and before production starts. There are liable to be multiple different competing vaccines out there. The data may not look great. We don't know yet. But hey, look at what we've been going through. If we get a vaccine that's 50% effective and needs a booster in 6 months or every 6 months, I think we'd all take that compared to the incredible social disruption we have. So, you know, masks aren't perfect, but they take the edge off the transmission rate. Hand washing isn't perfect, but it takes the edge off the transmission rate. Anything we can do to take the edge off is going to be worth doing. And for many people, having just lived through what we've lived through, even a modestly effective vaccine, I think people would jump at. Now, there's always going to be the anti-immunization crowd, and you'll hear the same arguments you do about flu vaccine every year. Why should I bother? It's only, 60% effective. Well, I'll take 60% less chance getting the flu in a year. And you can build herd immunity. That's the thing. Even a modestly effective vaccine like flu or like COVID vaccine may be, if we get enough people in the right settings immunized, it can help turn the curve around by building herd immunity, even if it's very transient. So it may well turn out, guys, that this is an annual vaccine, just like flu. We just, of course, don't know yet.
Maybe we should do a combo vaccine of flu and COVID, and then that way we boost those flu rates just as a bonus.
Yeah.
Yeah, but that would require its own set of trials. So we're gonna get whatever we get, and there's gonna be a lot of pressure in some sectors to use it right away. I'm honestly a little concerned about how aggressive how aggressively it may be pushed right away and run into some uncommon side effects that they couldn't pick up in the phase 3 trial, and what that will do for the future of it. But hey, this is such a mess. We got to act with whatever we've got.
Well, and that has an impact on all vaccines. It's, you know, it's that vaccine,
I know,
you know, confidence.
I know.
So.
We're taking a risk.
Well, and I think that it doesn't underscore, and I know we're coming close to time and I want to make sure Debbie has a chance to say goodbye, but it really helps illustrate that we have our work as TAPI, and just, you know, you are all TAPI, we are all TAPI. It's a partnership. So TAPI doesn't exist if everyone's not engaging their voices, and making sure that we not only educate the community about how vaccines work, why they're effective. You know, we know, can you get the flu when you get the flu shot? Yes, you can get the flu. You're a lot less likely to end up in the hospital. You get a lot less sick, and darn it, you're back at work in 1 week instead of 3. But I think that healthcare workers have gotten better at communicating that to patients over the years, which really helps us position us a little bit better for this year for flu season, when the flu vaccine is so critically important. And when it comes to COVID-19 vaccine, when it comes, it's going to be the same thing. How do we make sure that we can support one another to give that strong provider recommendation, right? Because that is what we know makes the biggest difference for patient compliance, giving them facts and making sure that you deliver that with confidence. So, okay, Debbie, I kept time. We're ending on time, which is great. Even with Dr. Bob figuring out how to unmute himself, we're ending on time. So this is like, planets are aligning. I know that we're going to get rid of all our flu doses this year, but
That was one time, Rebecca. Poor guy's never going to live it down.
Go ahead.
Okay. Well, I just want to say a great big thank you. This is the only way we are going to get everyone on the same page, ready to move forward, working in partnership, and make sure that we get into every little nook and cranny of this state. We have to align our active partners with our county partners and all the folks who are ready to step up. I want to acknowledge the folks who put this together today, because most of them suffer from post-traumatic stress from H1N1 campaign. And that was an interesting one, because people assumed that the vaccines would be available from their healthcare providers, when that wasn't necessarily the case. When you have prioritized distribution of vaccines, there may also be special delivery processes, and we still have to figure that out. In fact, we have a lot of work to do. We have been working to flatten the curve with COVID. We know that our staff is completely stressed and could use a break. We will probably have a new curve starting if flu makes a presence in this state, but we can get ahead of it if we start today. We're waiting to hear the marketing plan that's going to be coming from ADHS. And our objective at TAPI is that all of our partners deliver the same message, so that anyone who's even on the fence about flu vaccine gets that message from somebody they trust. And there's a lot of work to do. So with that, it's time to sign off, but I want to welcome all of you to the group referred to as the Floozies. This is the group that survived H1N1, and we don't use the word flu around our group very often, because in our world it's referred to as the F word. So with that, you are now all officially Floozies. You will hear from us again soon. There will be more information coming, and we have all your names, addresses, and phone numbers. So you are now initiated. Welcome and goodbye.
Thank you, guys.
Thank you.
Goodbye.
Thank you.